The first thing as a physician prescribing a therapy for a patient with psoriasis, we need to have a full understanding of the patient's overall health. Do they have history of malignancy, history of unusual neurologic problems, including optic neuritis or Guillain-Barré? We have to specifically ask about these questions as patients forget to tell us. So TNF inhibitors, for example, which are so effective and well tolerated, well, you can't use that in a patient who has a history of multiple sclerosis or optic neuritis and things of that nature, because those patients could be made worse by TNF inhibitors. The new IL-17 inhibitors work very well for psoriasis. Secukinumab is an example of that, but in the prescribing information we're warned not to use it in people with a history of Crohn's disease, inflammatory bowel disease, because in fact when they've tried it in that population it resulted in disease worsening, not benefiting the disease. Well, I think that we're really in the golden age of psoriasis treatment, where we're getting closer and closer to being able to say to most patients, we could get you clear or pretty close to clear with the agents we have. And so the unresolved major questions will be one is how long can we keep people clear or almost clear with these new medications? Will it be what we saw with the older therapies, TNF inhibitors, for example, that some people respond very well, but over time they lose response, or will they have durable, long-term control of their disease, which is really what patients want. Second issue, of course, will be long-term safety. So far, the safety readouts are very encouraging for these newer therapies. But that is relatively short-term, relatively smaller studies, so we'll need long-term 10-year studies to fully understand what happens when patients are on these drugs for a long period of time. And then finally, the major place where the field is trying to go is understand if I treat psoriasis successfully, will I not only benefit the patient's skin, but will I benefit their overall well-being? Will they have fewer incidences of developing diabetes and cardiovascular disease and live a longer, healthier, more productive life? Certainly we continue to learn a tremendous amount about this disease as more research comes to bear. In the 1980s, it was thought to be just a disease of epidermal proliferation. In the 90s, it was thought just to be a T-cell disease. In the 2000s, it was a TNF-alpha disease. And now we're pretty convinced that it is a IL-17 pathway disease. So stay tuned. We'll see what we think about in the year 2020.